Hey, we're here in studio today with a guest that actually could serve as two guests today, and we might actually keep her for two segments, and you'll see why here in just a second. This is Dr. Ashley Coerver. Doc, how are you?
I'm good. How are you doing?
I'm great, thank you. I appreciate you coming in with us today.
My pleasure.
So I was reading your bio before we got started today, and honestly, I've had a dentist on here before, and you are a dentist.
Yes, sir.
But then you're not just a dentist. You get into this whole sleep therapy, help people get a better night's sleep.
Yes.
But going back to the dentistry, they kind of tie in together in one way or another.
They do.
So we're going to be all over the board here today. And if you don't mind, I'm telling you up front, we'd love to keep you for two segments.
Sure.
Because as good as I am, there's no way I can cram all the interesting stuff Dr. Coerver does into one segment only. So here we go. Going back to the dental part, how long have you been practicing dentistry?
For almost 11 years.
Are you kidding me?
Yes.
You know, Dave, it's just one of those signs, you know, when you're getting older, when you look at the dentist and she looks like she sold you Girl Scout cookies yesterday, and now she's been practicing dentistry for 11.
I think she did.
She probably did. She had it planned all along. She'd make sure people ate lots of Girl Scout cookies, so
Yes.
they needed a dentist.
Yes.
And her
She
career.
She was
Yes.
handing out gummy bears in the back earlier.
Here, have a gummy bear.
And her card.
All right.
Job insurance.
So you've been practicing. Are you practiced here in the North Texas area the whole time? Have you practiced other places as well?
No, I've been in North Texas for almost 4 years.
Okay.
And I practiced in Oklahoma City area for 7 years.
Okay, gotcha. So all in 11 years.
Yeah.
So do you do all sorts of dentistry? For example, I know some dentists, all their patients are children, some are adults. Do you work the whole gambit there?
Yes. We treat children and adults.
Wow.
Yeah.
So there's got to be a big difference. But I'm guessing, speaking as an adult dental patient myself, you're better off with kids. But actually, and I've gotten better over the years
Sure.
as dentistry is improved, or maybe I've just gotten older.
Yeah.
But is there
Do you still bite?
do I? Yeah, occasionally.
Yeah.
But is there a marginal? I mean, you've been on it for 11 years, which that's a long enough time, and I'm guessing in your 11 years there's been a lot of changes.
Yeah, there has for sure. Technology, continues to push everything forward.
Sure. Well, and that's good.
Yes.
And a lot, especially with the kids. I mean, you go to
Yes.
the dentist office these days, they're really cool, comfortable. They're inviting.
Yes.
That's not an accident.
Yes.
Yeah. With the calming colors.
Yes.
And maybe you have headphones. I have headphones as an option.
Yeah. And we have TVs at the foot of the chair and also on the ceiling for the patient. So when they lean back, and then they can watch the TV. And then we also have, in each room has a tablet. And so when a patient comes in for their first exam, we'll take pictures inside of their mouth. And what I like about the tablets is I'm able to show the patient what I'm
so they can
seeing.
see what you're seeing.
Yes, and it also helps us intervene earlier with treatment. So, I wear the magnifying glasses when I'm looking in the patient's mouth. And sometimes I'll look in the patient's mouth and think, oh, that looks okay. And then I'll look at the picture because it's blown up on the screen and realize that there is treatment that's needed.
So they can see that too and say, I'm not a dentist, but you're right. We need to fix this.
Yes,
Okay.
yes. So that helps us treat earlier, and which is better for the tooth, better for the patient, better for the pocketbook.
Yeah, for all concerned.
Yeah, for sure.
So we have a lot of different businesses on here, and people are always surprised to think of, you're a dentist, but you're also a businesswoman.
Yes.
And there's a whole lot of, you went to school a long time to get to where you are now at dentistry, but in dental school, do you take business classes? Do they teach you the back office stuff that you need to know now that you're in practice?
Honestly, it's very limited.
Yeah, that's what I've heard. That needs to change.
I agree, yeah. And so I was an employee for 7 years before I started my own practice. And so, which helped a lot because I was able to kind of see ins and outs and know what I wanted to change and what I wanted to keep.
Well, I'm sure you've had mentors over the years from the dentist side, but for the back office,
Yes.
Here's what you need to handle with labor issues, rent for a building.
Yeah.
How do you get a loan to get set up? That's all. There's stuff that people don't even think of.
Right.
But you're right in the middle of it.
Right.
So as a small business owner, do you go to the extremes of let you just focus on the dentist part and have other people to help you out with the rest?
I actually enjoy most of the business, and
Okay.
I have most of running the business, and I enjoy growing the business and looking for different ways to grow it too. And I've had mentors. I still have mentors because you're a dentist, you're a business owner, and you're also a manager, and you have to manage your team.
Yeah, well, there's that detail too.
Yeah, and so it's definitely a different world, but it's important to surround yourself with good people who can give you good advice and direct you in the right direction. And I've been fortunate to have some really good people throughout my career.
That's good to know, but still, at the end of the day, is Dr. Coerver's name on the door.
That's true. It is. Yeah.
So
yeah.
you have your image to
Yes.
uphold. All right, now diving a little deeper into the dentist part.
Sure.
I'm fascinated, and we're going to get into this over both segments, how dentistry can tie in with people who have trouble sleeping.
Yeah.
What is that?
That's a great question. So dentists are able to help many people who have sleep issues, or if they're not getting enough oxygen when they're sleeping, or if they're waking up multiple times because they might be struggling to breathe, with an oral appliance. And so that's how dentists have gotten into the world of sleep. And so that's great for patients who, the go-to treatment for sleep breathing disorders for years was a CPAP, which is a mask and a hose and an air pump.
Familiar with those.
And so, many people are intolerant of that. And so dentists are able to help with an oral appliance.
Really?
Yeah.
So this is the whole sleep apnea thing. It seems like it's just come around in the last few years.
Yeah.
It's obviously been around forever, and people
Right.
didn't know what the heck it was.
Right.
What was the big change? All those sleep studies and stuff, or?
Well, I think awareness is just the main thing. Years and years ago, they didn't even know that this was an issue,
Yeah,
right? And
for sure.
they weren't aware that it caused all these health issues, diabetes, stroke, heart attack, if left untreated, because patients aren't getting enough oxygen when they're sleeping, and so their body is chronically stressed because they're trying to cope with the lack of oxygen at night.
Wow, and then they don't get the sleep, which is going to add to depression and
Yes.
low job performance and
Yes.
just a lethargic. It
Yes.
just it affects every part
does.
of your life.
It does, yeah.
Personal relationships, everything as well.
Yes.
So when you were going to dental school, did you go in with the mindset that you were going to also get into this, or how did that develop to where go from just strictly a dentist but to evolving into this other spectrum as well?
That's a great question. So when I opened my practice almost 4 years ago, I always am looking for ways that I can better serve my patients.
Okay.
And, whether it's, we've added Invisalign, we offer oral conscious sedation for patients who are anxious. And this was kind of one of the things that I wanted to be able to offer my patients. So I'm able to treat them better. And so that's how that's how it happened, and I went and took the course and really found out that I was really passionate about it, because we're able to improve patients' quality of life by treating their teeth, but with sleep we can actually prolong their life and give them a better life.
Yeah, we've had, as I mentioned earlier, we've had dentists on here before, and I'm guessing you're going to agree. I'm not putting words in your mouth, but it's got to be a neat experience going back to improving patients' looks to
Yes.
see the before. When you get to the after pictures with the before, I mean, that's got to be monumental.
Yeah.
Not obviously for the patient, but for the doctor
Yes.
as well.
Yeah. It's a lot of fun for sure.
It's got to be a whole lot of fun, and then that just changes everything about a person.
It does.
So
It
much
does.
about your personality starts right here.
It
And
does.
if you're not comfortable right here, you're going to talk like this. You're not going to look people in the eye. It could impact, obviously, relationships,
Yeah.
going on a job interview, whatever.
Yeah.
But to have someone like you that truly, in your own way, is a magician to change people around. And it's not just you, it's your staff and
Sure.
everybody. That's got to be a neat thing.
Yeah.
too.
Yeah, it's great.
On the sleep apnea, are kids affected by that or no?
Yes, they are.
Kids are too?
Yes.
Wow.
And actually, I was just talking to one of your coworkers earlier about how a lot of kids that have ADHD symptoms might be because,
They can trace it back to that?
yes, and so they're fatigued during the day and they're trying to stay awake, and so they're hyperactive, right? Because they're trying to keep
Trying to keep
themselves
the body
awake.
going.
And so kids are affected also. And
Wow, I
a
hadn't
lot
even
of
thought
a
of
lot
that.
of people think it's a weight issue, but really it's an anatomy issue. If there's enough space in the airway.
So you can do that even for the people that can't. Well, we're going to talk about the CPAP machines and all that later too. And I'm really intrigued that you can make an oral deal, and you make it right there in house.
Well, we do have
you-
a temporary one we can make in house.
Right.
Typically, the best is a custom appliance,
Okay.
which we take a mold of the patient's jaws and send it into the lab.
And go from there. But at least you can get some temporary help while
Yes.
you're waiting for that to
Yes.
happen. And you're doing it with the dentist that you're comfortable with anyway. And you have this other thing. She's there for you too.
Yes,
And again,
absolutely.
not just Dr. Coerver, but she and her staff here in the North Texas area. She's been doing it some time. As we were joking earlier, dentists are always practicing, and the reason is technology is always changing. And I want to go to somebody that's changing along with the technology. And I was glad to hear you say that. So we're going to take a break here real quick. We're going to come back with you and with you folks. We'll be back here with Dr. Ashley Coerver, talk more about everything from why you can't sleep to why you need to get those teeth fixed right here on All In. See you here in a sec.